for my procedure. So I'm gonna log into my EHR, look at my patient. I see that my patient has a low hemoglobin from the lab this morning. The hemoglobin is 6, and he requires a unit of blood transfusion the provider has ordered, okay? So now I'm gonna walk into my patient's room, perform hygiene, close the door. Hi, good morning, Mr. Smith. My name is Christina. I'm going to be your student nurse for today. Can I please have your name and date of birth? Okay, I'm gonna check your ID band. It matches. Do you have any allergies? No? Great. So Mr. Smith, are you in any pain right now? No pain? Okay, fantastic. The reason that I'm here is because your lab values were a little bit abnormal this morning and the provider has ordered a blood transfusion. Okay, has the provider been in to speak with you? He has? Okay. So I don't see an informed consent. That would be the first thing that we're gonna do. Can you tell me before we continue, where are you? West Coast University Hospital. Okay, what year is it? 2021. Great. So my patient, I can tell, is oriented. All right, Mr. Smith. So can you tell me in your own words why you need a blood transfusion? You lost a lot of blood during surgery. Okay, fantastic. And are you aware of the risks? Yes. Okay. You don't have any questions for the provider? We'll get informed consent. I have informed consent. All right. The next thing that I'm going to do is we need to draw your blood to do a type and screen and cross-match to check for your blood type, okay? So I'm going to call my second witness to come. We're going to draw the blood, label it with the appropriate labels, okay? At this point, once you do this, I will give you the blood bank ID, all right? So now that we've done that, we're going to apply the blood bank ID to the patient, okay? I'm going to send that off to the blood bank and to the lab. And I'm also going to complete my request form and send that to the blood bank. All right, so while we wait for the blood to be ready, because it's going to take about an hour, I'm going to take this time and make sure my patient has an IV and that it's patent. It is, okay? I am going to obtain a set of vitals just to make sure that everything is okay with my patient. And I'm going to take this time and educate. So Mr. Smith, just want to let you know, by the way, have you had a blood transfusion before? Never. Okay. So I will be with you for the first 15 minutes of the transfusion just to make sure that you don't develop a reaction. Some of the signs and symptoms of a reaction, which I do want you to notify me at any point during the transfusion and even afterwards. All right. If you experience any pain at the IV site, back pain, any chills, fever, flushing, itchiness, hives, rash, if you feel, anxious or you develop any coughing or difficulty breathing, I need you to let me know immediately, okay? All right, perfect. So I'm gonna go ahead and gather my supplies. All right, and I'm gonna need my wide tubing and normal saline, okay? All right, so I just got a call from the blood bank that my blood is ready, so I'm gonna leave and I'm gonna go pick that up and I'll be right back, Mr. Smith, okay? All right, so I'm gonna go, I'm gonna give you the blood, you're gonna come back into the room, all right? Wash my hands again, ask for my patient identification, okay? Now I'm gonna put on some gloves. All right, Mr. Smith, so I'm gonna call another nurse. I need a second witness so that we can identify your blood. Alrighty. My blood with my request form. Now this usually comes attached in real life, guys, okay? It's like stapled together. So second nurse, you can have that, right? I'm gonna look at my patient's ID and blood bank ID, and we're gonna begin by reciting the name, date of birth, medical record number, and blood bank ID number. So I have here Lloyd Bennett, date of birth 11/5XX, medical record number PCS 11500, blood bank ID 00459444. Correct? Correct. Okay. Now, I will look at the form while the other nurse looks at the blood, and we'll repeat the information. So I have Lloyd Bennett, date of birth 11/5XX, Patient medical record number PCS 11500 and blood bank ID 123-112-9499. Correct? Correct. Patient blood type O positive. Positive, O positive. All right. So now that the information matches, all right, and again, we have compared patient ID and blood bank ID to blood, and then blood to request form. All right. Thank you, second nurse. You may leave now. I will now go ahead and check for the expiration date. I see my unit is not expired, and I will check for any clumps, clots, discoloration, etc. All right. Perfect. So that is good. I'm going to set that aside. I'm going to remove the white tubing from my package. All right. Now, when I remove my white tubing, the very first thing that I want to do is clamp everything. All right, so this one's clamped. I'm going to clamp this one, and then I'm going to clamp my roller clamp at the bottom. And make sure everything is clamped so nothing runs out. Okay. First thing I will do is I will spike my normal saline. Give it a good squeeze in my filter. You don't have to, don't fill it up. All right, and then I will release my roller clamp and prime my line, okay? Making sure that there are no bubbles in my line. Once I've accomplished that, I'm gonna clamp, and very important, clamp the saline because I don't want any blood to come back up here. So a little trick that I like to do is I like to bring my clamp all the way to the top and clamp it there so I can see that it's clamped, okay? I'm gonna set this aside really quick. And now I'm going to spike my blood. Okay. Again, make sure my saline is clamped. It is. Now, make sure this is clamped. Unclamp my blood. Give it a good squeeze or two. Remember, blood is thick. And now, I want to essentially do this over a biohazard bag in case I spill any blood. But my goal is not to spill any blood. So, I'm going to let it run through. And once I see the blood getting towards the end, I'm going to slow down my roller clamp so that I avoid spilling any blood. So I can see it here because it's light. I'm gonna do it a little further so you guys can see it. But I'm gonna make sure that my blood gets to the end without spilling anything. You know, obviously 1 or 2 drops may spill. That's why you wanna do it over a biohazard bag. All right, at this point, I'm gonna turn on, I'm gonna put in my cassette. Close this. Alright. And at this point, what I can do with this is I can connect it to my patient. So I can clean my hub. Alright, I've already flushed it, clean it, and connect it. Okay. I will take this time to now get my full set of vital signs: heart rate, respiratory rate, blood pressure, oxygen saturation, and temperature. Okay. And then, once that is done, I'm gonna go here. We're gonna turn it on. All right, this may be hard for you to see, so I'm gonna walk you through it. But when you turn it on, It's gonna ask you if this is a new patient. Yes, I've never dealt with this patient before. Am I in the medical surgical unit? Yes. And then I'm just gonna hit confirm down here for my patient ID. It's asking me to select a channel. Obviously, I press here, nothing happens. I need to go to my physical channel and select channel here. Okay, and blood is gonna be under IV fluids. So guardrails, IV fluids. It's gonna be on the second page, so go page down. Blood, red blood cells. It's asking me to confirm that I want blood, red blood cells. Yes. And now, what I showed you guys over there, rate and volume to be infused. So for the first 15 minutes, I want to deliver 2 mLs per minute. So 2 times 15 is 30. So my volume to be infused is 30 mLs. And my rate would be 120. Okay? So I have this ready to go. I've done my set of vitals. I can press start. I've pressed start. All right, Mr. Smith, I'm gonna be here with you for these first 15 minutes. You let me know if you experience any symptoms, okay? 15 minutes have passed by. My machine has stopped. Bless you. All right, now I'm gonna obtain a full set of vitals again. If notice that there's no discrepancies from the baseline, I will go ahead and reset this. My order said to infuse this over 3 hours, so, and my bag is 300 mLs. So 300 mLs, I've already given 30, so that's 300 minus 30 is 270. So my volume to be infused will be 270. And then my rate over 3 hours, so 270 divided by 3 hours, my rate is gonna be 90. Okay, and I'm gonna press start. Okay, Mr. Smith, I'm gonna step out. I will be back at the 30-minute mark, 1 hour mark, and every hour thereafter to check on you and do vital signs. If you need anything, here's your call light. Please give me a call. Okay? Now, that is, don't stop recording. That is what you have to do for validations. At this point, I'm gonna give you a scenario, and you're gonna tell me what you're gonna do, right? So for example, I may tell you, it's been an hour, you walk into your patient's room, and you hear that your patient is coughing, a cough that you haven't heard before. All right, so what do?
That's a reaction.
It could be a reaction, so I'm gonna stop the transfusion. And how do you stop it? You guys can pause it right here, okay? So you're gonna stop the transfusion. I'm gonna assess my patient. So when I assess my patient, I hear wheezing. So he's coughing, he's wheezing, right? I can determine that he's having what type of reaction? Anaphylaxis, right? So I've already stopped, I've assessed, I'm gonna call the provider. And what is the provider gonna order?
Epinephrine, antihistamine,
bronchodilator,
antihistamine.
Okay, so epinephrine, bronchodilator, antihistamine, anti-inflammatory. Perfect. That's it.
For the validation, are we actually gonna call the provider? You're gonna